Chapter 45, Orientation to the Lab. Please take a few moments to read the learning outcomes. Section 45.1, the purpose of the physician's office laboratory. A reference laboratory is owned and operated by an organization outside the practice. The physician's office laboratory, POL, will be contained within the practice. The purpose of the POL is to provide accurate and more timely processing of routine tests and for reporting test results to the physician. A reference lab offers a complete range of tests in all specialties and subspecialties. 45.2, identifying the medical assistant's duties in the physician's office laboratory. The medical assistant's role in a POL may vary, but could include preparing the patient for the test, collecting the sample, and completing the test. The medical assistant's role also includes reporting the results to the physician and communicating information about the test from the physician to the patient. (45.3) Use of laboratory equipment. As used in the past, an autoclave is used for sterilizing or eradicating germs and disinfecting office equipment. A centrifuge spins at a high rate of speed to separate elements into their parts. The instrument used most often in the POL is the microscope. The optical microscope is also called the light microscope and is the most often found in the POL. Compound microscopes use two lenses to magnify the image, giving greater magnification than one lens can provide. The oculars are the eyepieces through which an image is viewed. A microscope is either monocular, meaning mono meaning one, or a binocular, bi meaning two. The ocular contains a magnifying lens called a 10x lens that usually magnifies the image 10 times. Just below the oculars, the objectives are mounted on a swivel or rotating base called the nose piece. These pieces of the microscope will be the closest to the object being magnified. Two of the objectives are dry, with airspace between the specimen and the objective. The third objective is called an oil immersion objective, which is used for specimens that need extreme magnification. It is designed to be lowered into a drop of immersion oil placed directly on the slide above the prepared specimen. An oil immersion objective has a magnification factor of 100x. The oculars and objectives are collectively referenced to as the body tube and attached to the base of the microscope arm. The microscope arm is located between the base and the stage. On the arm, the focus controls for coarse and fine viewing are available. The specimen will be placed on the stage on a platform, which is held in place by metal clips. These are known as stage clips. Under the stage is a substage where the condenser is located along with the iris, which is a diaphragm that opens and closes like the shutter of a camera to increase or decrease the amount of light illuminating the specimen. The light source is usually built in, but in older microscopes, it may use a mirror to gather light to focus from and onto the microscope lamp. The specimen slide is not technically part of the microscope, But the equipment cannot be used without it, because all specimens must be placed on a slide. Many slides will require a cover slip to support and position the specimen. A cover slip will also keep the specimen from being contaminated. The microscope must be kept clean and carefully stored to prevent contamination by artifacts or foreign objects visible through the microscope, such as skin, oil, dust, and eye makeup. Electronic equipment is used in the POL because it is safer, more accurate, and more efficient than manual methods. Tasks such as cell counting and complex chemical analysis are performed with electronic equipment. A photometer or photometer measures light intensely and is present in a handled glucometer to measure reflected light. Precise measurement is critical in the POL because it produces accurate test results. Metric system units are commonly used in the POL. A variety of equipment is used to provide accurate measurements. 45.4 illustrate measures to prevent accidents. Safety is a primary concern in any laboratory environment. Awareness and observance of all laboratory safety guidelines is stressed. Use standard precautions when handling all body fluids, excretions, and secretions. And at this point, we're going to discuss your discussion board for this week. Your discussion board for this week, I would like you to talk about standard precautions versus universal precautions. Why are they important? What are the difference between the two? And how should you handle specimens properly? A one paragraph with one in-text citation, not your textbook. This is due by Friday. Every specimen should be treated as if it were contaminated. Mouth pipetting is prohibited at all times. A pipette has a bulb on top. When you squeeze it, the liquid is drawn up into the cylinder, similar to a turkey baster. Mouth pipetting is more like a drinking straw. Please do not mouth pipette your samples. Despite all precautions, laboratory accidents will still occur. Written procedures should be kept available to follow, but the medical assistant should be familiar with the procedures beforehand. OSHA regulations for incidents involving blood or blood products must be followed. The contaminated area will need immediate disinfection and sterilization. Incidents must be documented and alleviated for future prevention. Medical evaluation and follow-up of the employees involved may be needed. Housekeeping duties are designed to reduce the risk of serious contamination in the laboratory. Each office will have written policies and procedures to ensure housekeeping duties are done correctly and according to schedule. 45.5. Explain the goal of quality assurance program in a physician's office laboratory. CLIA, commonly called CLIA, was enacted by Congress in 1988 to place all laboratory facilities that conduct tests for diagnosing, preventing, or treating human disease and for assessing human health under federal regulations administered by the CDC. CLIA regulations and expense caused many offices to close their POL. An office could apply to perform only urine, blood, fecal, saliva, nasal smear, vaginal smear, throat swab, and semen testing to obtain a certificate of waiver. Tests of moderate complexity must be run by a pathologist who has an MD or PhD degree. Technicians performing the tests must have training beyond the high school level. Tests of high complexity are subject to inspection, proficiency testing, and participation in a high quality assurance program, which must be headed by a medical doctor or a scientist who has a PhD degree. Medical assistants will need additional training and education to perform moderate and high complexity tests. Each quality assurance program must include quality control, equipment and equipment maintenance, proficiency testing, training and continuing education, and standard operating procedures documentation. 45.5, the goal of quality assurance program in the physician's office lab. A quality control program is one component of a quality assurance program with a focus on accuracy of test results. Calibration ensures equipment is operating correctly and producing accurate results. The use of a standard specimen allows for testing calibration. Control samples are similar to standards, but are used before each patient sample is processed. Positive and negative control samples are used with tests that show qualitative response, or one in which the substance is present or not present in any amount. Quantitative test results give the concentration or amount of substance in a tested specimen. Reagents are chemicals used to test procedures and will also need calibration with a control sample. Maintenance and testing of all equipment is required. Careful documentation of all maintenance, testing, and control measures. All laboratories that perform moderate and high complexity tests, as identified by CLIA 88, must participate in a proficiency testing program that measures test results, accuracy, and adherence to standard operating procedures. Labs that fail proficiency testing may not be able to do that test or others again. Employee training and continuing education, along with written reference materials and documentation for all procedures conducted in the POL, must be provided to the medical assistant. Reference material could include safety data sheets, standard operating procedures, safety manuals, equipment manufacturers, user or reference guides, clinical laboratory technical procedure masks, regulatory documentation from OSHA and CLIA, and maintenance and housekeeping schedules. 45.6 Carry out communication with patients regarding test preparation and follow-up. The patient will need communication prior to the test if restrictions to diet and fluid intake are needed, or if certain medications should be taken or delayed. The test could be invalid if a patient has not followed pre-test instructions. Before collecting a specimen, proper patient identification is needed. Do not assume the patient is knowledgeable about a test being performed. A nervous patient may benefit from reassurance about the importance of the testing. Nonverbal communication can be even more important than verbal during specimen collection. Achieve a balance between formal attitude and overly friendly conversation. Treat the patient with respect. Provide privacy during specimen collection. Remain calm and patient. Never be abrupt or condescending. Unless an emergency occurs, pay complete attention to the patient during specimen collection. After specimen collection, explain any particular guidelines the patient will be expected to follow. The patient may need instruction on care of venipuncture sites, signs and symptoms of infection, additional or continuing dietary restrictions, or may need a follow-up appointment for additional testing or specimen collection. When the test results return, they are communicated to the physician and not the patient. Only the doctor is qualified to interpret test results for the patient. The doctor may ask the medical assistant to communicate results to the patient, and it is then acceptable to do so. If the patient needs further information than the medical assistant can comfortably provide, the patient should be referred to the doctor. 45.7 Record keeping. The laboratory requisition form must be properly completed to avoid improper testing or lost results. The completed form should be included with the specimen or sent with the patient to the outside laboratory. All specimens must immediately be identified by the patient's name, ID code, date, and time the specimen was collected. Initials of a person collecting the specimen, the physician's name, and other information as required by the test procedure or facility. Inventory control of equipment and supplies in the POL must be routinely managed and recorded systematically. Patient records with an abnormal finding should be circled or highlighted to bring them to the attention of the physician. Each physician will generally initial or otherwise indicate that the abnormal finding has been noted. Electronic health records automatically identify out-of-range tests when the results are entered.